Hello, I'm Meg French, the Executive Director of the Stephen Lewis Foundation. Welcome and thank you for joining us today. As we commemorate World AIDS Day, we at the SLF are taking time to reflect on the current state of the HIV epidemic around the world. The hard truth is that despite significant gains in access to treatment, healthcare, and education over the past 2 decades, 1.3 million people newly acquired HIV last year. Women and girls and LGBTIQ communities around the globe who face human rights violations, stigma, and discrimination continue to be affected disproportionately by HIV. At the same time, global funding continues to diminish, and the HIV response continues to fail them. The SLF is committed to meaningful partnerships with community-led organizations in Africa who support those who are most affected by HIV and AIDS. This includes LGBTIQ communities and the courageous activists and human rights defenders who lead them. Our Partners in Pride campaign provides funding for 13 LGBTIQ serving organizations in the Democratic Republic of the Congo, Kenya, Uganda, Rwanda, and Tanzania. This critical funding supports life-saving healthcare delivery, including mental health services, peer support networks, and safe spaces to gather and organize. Today, you'll be hearing from remarkable LGBTIQ human rights defenders and community leaders. This panel was filmed a few weeks ago at the ILGA Conference in Cape Town, South Africa. The Stephen Lewis Foundation partnered with the Eastern Caribbean Alliance for Diversity and Equality to lead a session titled Resistance and Renewal, Mental Health in the Fight for LGBTIQ Liberation. The panelists, who come from Kenya, Uganda, Jamaica, and St. Lucia, will be speaking about the important work they do in their communities and the immense challenges they must consistently navigate and overcome in the face of injustice. The SLF partners on this panel are part of our Right to Health and Healing project, which is supported by the Government of Canada, Dignity Network, Equitas, Doug Stollery, and the Stollery Charitable Foundation. The panelists will discuss the importance of growing mental health supports and services for their communities and for the staff and individuals who are doing the work. With adequate support, they can continue to protect and champion LGBTIQ rights in countries and spaces where their very existence is discriminated against and often criminalized. At this moment in time, well-funded anti-rights and anti-gender movements are growing around the world, requiring a global response from all of us who believe in equity and justice. This conversation will inspire, inform, and offer you insights on some of the important work that is already underway to protect human rights. We invite you to join the movement to defend human rights at this critical time. We invite you to join this conversation and the SLF in supporting these organizations through our Partners in Pride campaign. Together, we will champion health and human rights to build a future free from AIDS. Thank you.
My name is Leslie Wells. I am from the Stephen Lewis Foundation. We are based in Canada. If you're not familiar with the Stephen Lewis Foundation, we have been providing funding to support to community-based organizations in Eastern and Southern Africa for the past 20 years who are working on the HIV response. So we work with 96 different community-based organizations of all different sizes in 14 countries. And 14 of those are LGBTIQ-led organizations. And over the past few years, we have had the privilege of working closely with 6 organizations in Kenya and Uganda with support from the Canadian government to implement programming, mental health programming for their communities, but also for their organizations, their staff, and their leadership. And that experience and the knowledge that these folks have to share is what brought us here today in partnership with ECADE, the Eastern Caribbean Alliance for Diversity and Equity, to talk more holistically about what mental health looks like for queer communities in different parts of the world. So I will let Shadina speak a little bit about the work that ECADE does, and then we'll talk a little bit about how we're going to spend the next 90 minutes.
Hi everyone, my name is Shadina Maskell. I am based in Jamaica where I work for the Eastern Caribbean Alliance for Diversity and Equality. So we're a regional hub operating in the Eastern Caribbean, a human rights-based organization, a membership one at that. We have 26 organizations currently across 9 countries in the Caribbean region. Like I said, it's a human rights organization. So we not only focus on LGBTQ plus issues, but we also have organizations working with women and girls in smaller islands in the Caribbean. We have organizations servicing victims of sexual assault. And yeah, I think that's it. So that's really our mandate, providing support, core support to these organizations to build their capacity, to continue doing the work they do, to provide services to vulnerable communities in smaller islands where our laws, social behaviors, and attitudes may not protect the rights of these minor groups. So that's really, in a nutshell, what we do.
Amazing, thank you. So we're going to start off this morning with a panel focused on setting the stage a little bit, talking about how mental health and mental health challenges manifest themselves in LGBTIQ communities in these countries, what some of the most pressing issues are that our partners are working to address. And then we'll come back together at the end for another closing panel that's more focused on promising practices, things that folks who have been doing this work have learned and can share for any of you who may be interested in starting or strengthening mental health programs where you are. So without further ado, I will turn things back over to Shadina, and we can start with our first panel.
Hi again, everyone. So we have less than 90 minutes now, and I think we have a very ambitious agenda. So without any further ado, like Leslie said, this panel is really around setting the stage for the conversations that we'll be having and allowing person to kind of go more in depth into what mental health support for LGBTQI plus community looks like in their own communities and countries. So I will first start off with Lucien, who will be responsible for setting the stage. One, introduce yourself, tell us where you're from, and my question to you is, why is mental health an important issue for LGBTQI plus community, particularly now?
Okay, delicious. Thank you so much, Shadina. Hi, everyone. I'm Lucien. I must say that I'm a little bit nervous, so that's not good for my mental health. But we'll make it through. Yeah, so Lucien Govart is the name. I use he, him pronouns. I work at the Eastern Caribbean Alliance for Diversity and Equality, ECADE Secretariat, based in St. Lucia, and I'm the Director for Development. In another life, I have a background in public health, and so mental health is a little bit up my alley. Yeah, I think it's an interesting question. Something that I assume about this audience is that I am preaching to the converted, so there's not much that I need to make you aware of why this is an important issue, particularly now. But I'll still try and, you know, for stage setting purposes and to be in compliance with what my task is here, to give some responses to the question. And I think the first thing that comes to mind, and this is really a personal opinion, might be unpopular, is that mental health is an important issue because we're human beings. But then more specifically, our lived experience, I think, requires it. And this is not to invalidate anybody else's lived experience, but I think that what we go through as a community of sex and gender minorities, and that not being the only issue, we have color issues, we have race issues, we have, and so on, economic issues and so on. All of those layers to our identities and our human experience, our lived experience, I think as we're in our environments and interact with the environment require that we reflect and that we take pause and do what is needed to be balanced. So that is really, I think, the crux of why it's an important issue. But then there are other circumstances, I think, that we can also point to. We're living in a time where global volatility, I think, is on the rise. We're combating anti-rights, a well-oiled machine at that. So all of these little, sometimes, well, maybe little, but very significant elements of the now, the times we're in now, require that we focus on mental health as an issue personally, at the community level, at the organizational level, in our localities, at the national level, at the regional level, and at the global level. I always say it's that you cannot give what you don't have. And I think it's important to acquire those skills in order to be able to extend that to other people. And with that, I end. I think I saved a few seconds.
All right, thank you, Lucien. Thank you for that good start to this panel discussion. I will next move to Arnold. And what I want to find out from Arnold and what we want you to share with the audience is, what does mental health care look like for you in your community? What services are available currently? And based on the services that are available, what is missing?
Thank you so much, Adena. Hello, folks. I'm nervous, and it's good to acknowledge your emotions. My name is Arnold, and I work with Sexual Minorities Uganda. My pronouns are they, them. I will get right into it. Mental health care for the Ugandan LGBTIQ community is worrying and very concerning. Why I say it's worrying and concerning is because of the current context that we're in, a context where we have bad laws such as the anti-homosexuality law being used to criminalize human beings that choose to love differently. The other reason why I say it's worrying is because at national level, we have a national regional referral hospital that caters to mental health, but it is not as fully fledged and has all the services that are needed for mental health. And we all know how such systems are 10 times horrible for marginalized groups like LGBTIQ+ persons. So with such a health facility and the kind of bad laws that we have, it makes it 10 times harder for an LGBTIQ+ person to seek mental health services, especially from such national hospitals. The other reason why I say it's worrying is because even with the work that we have done, we still have very few people that are able, very few therapists that are able to provide affirming mental health care for LGBTIQ+ persons, because they do not have an understanding of what LGBTIQ+ nuances are, but also some of them are just biased and quite homophobic that they cannot provide the services that they are supposed to provide as mental health practitioners. However, with the help with the funding that we've received from people from donor entities like ACTIF, we've been able to do some work as a community to provide services for the community at our level. And I will transition into the second bit of the question to share with you what services we have as a community. We've been able to, through ACTIF, we have therapy services at different organizations. Sexual Minorities Uganda, Freedom and Roam Uganda, and Icebreakers Uganda have been at the helm of mental health service provision in the community for a very, very long time. We all have different initiatives that we use to provide the services. At Sexual Minorities Uganda, we have a program dubbed the Queer Connect Therapy, where LGBTIQ+ persons receive therapy from the therapists that we have been able to contract. And we have been able to work with the School of Public Health at Makerere University, and we have a professor that supervises the entire program at the organization. We have also been able to have psychological first aid training for emergency response in instances where we can't get a therapist at that very moment. We are able to connect a person to a psychological first aid responder to provide the help that this person needs as we wait for someone that is fully professional to come and provide what they can do at their level. We have been able to have journals and handbooks that act as Bibles for the people that provide the psychological first aid. What's missing is funding to sustain the existing progressive programs that we have at the different organizations. We all know that sustainability is a big issue. We cannot continue providing the services when we don't have the resources we need to provide the services. The other thing that's missing, we are missing resources to address psychosocial security. We all know when donors are providing funding that are related to security, most of the times, actually all of the times, they provide physical security funding. They ignore the element. We've ignored the element of psychosocial security, which is a very, very big issue that needs to be addressed. It could help us address issues around compassion fatigue for human rights defenders. Yes, I think I'll come to the end of my submission with that. Thank you so much.
Okay, thank you, Arnold, and I'm glad you brought up funding and why it is important, because that is a conversation that we'll be having in our breakout groups to kind of find out from everyone in the group, funding landscape for mental health support in their own communities and countries for the LGBTQI+ community. My next speaker is Kennedy, who is to my further left. My question for you, Kennedy, is, so we have various organizations on the panel today, and they have spoken in great part to how they're able to engage community members in the design of mental health services to make them accessible for them in spite of whatever other challenges they might be facing in their own countries. In your experience, why is it important for us to be taking this great effort to provide mental health services to the LGBTQI+ community in our own countries in light of our own realities?
Thank you very much for that question. My name is Kennedy, and I work for an organization known as MEIGO that is based in Western Kenya. And my pronouns are he, him. I'll say that one thing we need to acknowledge is that community are very resilient. And when it comes to problems, when it comes to challenges, they're in a better position to come up with interventions to solve those challenges. And it's very important to acknowledge involvement of community, because one thing, it creates ownership, and it makes community own these programs, because once community are involved, they're able to come up with better inputs and see how best to support a program and how best to give innovations in programming. I'll say that from my own experience is that our community involvement has ensured that services are tailored to the needs of the community, especially with the specific need and the preferences of the targeted population. And it also creates understanding of these unique challenges that we are having. So it gives room for interventions that are culturally relevant and effective in one way or another. I'll say that also involving community, from my experience, I'll say that it increases ownership as well as sustainability. Once a community are in a better position to understand or propose intervention, they feel respected, they feel honored, they feel that they are being heard, and they're in a better position to own a program, and they are in a better position to respond to those programs. So what normally you find the challenges are that interventions are not specifically tailored to the community. So community tend to shun away from those interventions, and that's why you find sometimes our programs fail. So from the onset of community involvement, it's very, very key. I'll say that this also helps to reduce stigma, because I've seen that in our interventions, when we started involving community, they were in a position to talk openly about mental health. And they were in a position also to acknowledge that this is a challenge within the community. So for the first time, these open dialogues created room for us to get better understanding what are the challenges and to ensure that community are involved in every aspect of implementation. When we came up with the psychoeducation part of our intervention, it was communities that proposed those kind of interventions because they felt that mental health education needs to start at community level. And I'll also say that it also enhances accountability because we've been able to report back to our community members. Community have been given spaces to give feedback about the interventions. They've been given spaces to acknowledge what is working and what is not working. And that, for us, it makes us more accountable. It makes us to reprogram better. It makes us refine the interventions that we have. So to me, I think it's very, very important from the onset to involve community, because it will be more sustainable, it will be more practical, and these interventions will be more tailored. And I feel it's also a human right intervention. Once you involve community, it's a human right issue. So if you don't involve them, it's a violation of rights. Thank you.
Thank you, Kennedy. Good conversation. It's good to know that in thinking of mental health support, we also have to think about who we are providing the support to, making sure that we're tailoring it to the needs of the community and basing it off our own realities in our own country. And Brant will just wrap us up with talking about the importance of So we've been talking about the importance of providing mental health support to the community, and this is something I'm passionate about because all of us are putting ourselves out there, making ourselves accessible to the community and ensuring that in the programs and the projects and how we're implementing them, they're in the best interest of our community. But what does mental health support looks like for LGBTIQ plus human rights activists, advocates, leaders in our different organizations? Why is it important for us to have access to these services ourselves?
Thank you so much. I'm called Oswata Brandt. I work with Icebreakers in Uganda. We operate the first ever LGBTI clinic in Uganda. So I will tackle that question with contextual and workload of actually HRDs or leaders. Most of the time, we talk about communities. Communities, we need to serve the communities. Who serves us as leaders in the communities? I'll share an experience where I was the clinic manager before I was named the executive director, whereby I used to go to hospitals, see people die, go to mortuaries, carry them out, go to the burial. So I reached an extent whereby I was running mad, but no one actually was caring. Yeah, and by the time I think in Uganda or globally, we didn't know the definition of mental health. Yeah, so it really affects our performance. And actually, most of you guys know that most of our leaders have left countries to go for better future. Why? Because they face a lot of challenges. Picture it when you woke up in the email saying, we regret to inform you, but your concept note has not what? Gone through. You wake up every day, your organization has been raided, the people have been arrested. So how do you cope? Yeah, and yet we have a very minimal or no funding regarding actual mental health of leaders. I'll talk about Active. Active support us to do retreats for leaders and peer educators, but it's not enough. Yeah, and that support goes to Icebreakers Uganda, one of the very many organizations that we have across the globe. So we need, as funders, stop actually telling us, no, for us, we shall actually fund only activities. Fund mental health of leaders and frontliners. I was part of the organizing committee of Pride, yeah, in Uganda, but every time the police has raided us, we have to make sure that our communities are out and safe. But what of us? Yeah, you end up going. Some of us who are not even actually are not out. Yeah, you end up going to broadcasts, newspaper, talking about you. So really, let us look. If you're talking about mental health, yes, for communities that really kudos, but then for leaders. Yeah, because actually I've seen most of the leaders here. You're in the one session, you're running back to emails, you're running back to phone calls, you're running back to Manyawat. So really, let us think about that. I'll talk about also services. Some of us leaders, we cannot actually access services where we lead. I don't know where you get that. For example, if I employ a clinical psychologist and I have something I'm going through mental health challenges, can I go to my employee? How can I start cry in front of actually my employee? Brant has lost it. I think Brant cannot lead in this. So we need innovation that can look into the mental health of leaders and frontliners. Don't forget the peer educators, because as you know, as PEFA tools, today there are 10 tools, tomorrow 40 tools, and then you have to do this. By the time peer educators, they are worn out, They don't know what to do. We've seen them actually stepping down, like, you know what, Brant, I really want to work for my community, but the level of work I'm doing, I cannot do that. So we need also to look into those are leaders that actually extend services to the LGBT community. The fight is not yet actually done, but then we can make it happen. I don't want to see Uganda, all the activists from Uganda leaving Uganda because of mental health challenges to other communities. If you go to statistics in Uganda, when these laws, discrimination started, we've lost most of the leaders. They've gone to US, they've gone to Canada, they've gone to where they feel that they are safer, or their mental health actually being looked into. But then when you actually have you come up with a budget line, and then say you define, we shall need rest and respite for leaders. The funders will be, first remove that. How is it going to contribute to the what? So I call upon all the people, it's not only in Uganda, across the globe, to ensure that we address the mental health of leaders. Thank you.
Okay, thank you. And that is the last question I have for the panelists. We're a bit strapped for time, but I have 5 minutes available for anybody who has any questions, concerns, comments from the floor.
Hello everyone, I'm Penny from Uganda. I work with Grace Pro Women Foundation. I think we all know the Anti-Homosexuality Act that was passed in Uganda, and we can all relate to the violations that have been going on. Just wanted to share about, I think, funding and sustainability of mental health work that is being done. Because yes, you might be looking for funding, but even the existing funding is not enough for the people that are receiving the services, for the projects that are running, and there's repercussions in even reducing the funding. Because I think when the bill was passed, there's a lot of funding coming in. How are people dealing with this? How are people handling this? How can we be of help? 2 years later, the donors are quiet, the funders are quiet, and there's no more money that is flowing in, and there's deterioration in how the services are being delivered. So maybe to say we need more sustainable funding, because it's quite expensive. It's not just talk therapy. You have people on prescriptions, they're taking meds. It's continued service delivery, hence needs sustainable funding. I think, yes, the other thing is about the reluctance for, I think, human rights defenders to seek mental health support. They were highlighting how you cannot go to someone you work with to actually have talk therapy, to get a prescription. There's no insurance for mental health. Most people don't have that insurance, so it's limited. So I think I can also maybe caution all of us. Someone mentioned how we are converted, but there's a lot of us that are not converted. You're hesitant to go to see a practitioner because you're worried about what are they going to think of me, what are they going to think about me speaking in spaces. So I think we should also caution ourselves to be more willing to seek mental health support.
Thank you. I just have a small comment, and I'm just echoing something that Brent talked about around how mental health support is looked at when it comes to programming. Because often when funders or people who look into supporting mental health, they usually will place it under like activities or health-related work. And yet when you look at entities like my entity, for instance, that is doing work around emergency response, one of the big priorities that is required when you're giving holistic protection to someone that is facing an emergency situation is mental health. And a mental health that is not only looking at the immediate person that looked out for mental health, but that is diversified. Because sometimes what has happened to this person is affecting, let me say if someone is a mother, what has happened to them could be affecting their children. What has happened to me as an activist could be affecting my partner. And then when they're looking at providing support, they will only look at me. So I am being supported at the same time that my partner is breaking. So we're just then going to go through this cycle. So how then can mental health support be as diverse as possible to cover beyond the person that you think is at risk, but also how do we now look into AI and digital technologies and how mental health can be provided on digital spaces while also considering issues of protection of data, protection of the person, digital safety and stuff. Thank you.
And the last comment right here, my apologies.
Hi everyone, I'm called Sean from Uganda. And I'm really blessed to be in this space because most of the Ugandan team on the panel, these conversations we've had around compassion fatigue. What does it mean for us as frontline activists, as frontline reactors, as crisis responders, to be at the frontline, to be the shock absorbers of most of our communities, challenges, issues? Arnold and I do a lot of work around response in terms of emergency response, real-time emergency response. And you find yourself being a therapist, like the first for this person who has come to you, yeah? And now you hand about 10 cases in a day. And going back to what Gloria has said, this is now you get this self from work and then you take it home. So I think we need to also really think, again, just adding a voice on what these guys have said, can we really work around compassion fatigue? Like, because it is something that is tearing us down. That is why most of us are burning out. That is why some of us are no longer interested in the work that we love so much to do. So we've tried to do work around it. We've created resources, created spaces, but these are also not enough. We've created a resource on compassion fatigue in collaboration with SMAG, but this is not enough. How do we get this translated into other languages that is beyond English to have them accessible to our peers who barely speak English, yeah? So yeah, thank you so much.
So I want to thank my esteemed panelists. Thank you for joining us today. Thank you for talking about the issues in your own context, in your own communities, the challenges that you may have, and an important, two important things that came up: funding for mental health support, and what does mental health support looks like for staff, leaders, and partners, and other dependents of the activists who are in the forefront fighting the battle. Their faces are all over the media, in public spaces, etc.
So we're going to close out our time this morning with the last panel focused on promising practices. So some of the techniques, programs, experiences that our partners have had that they would like to share that might be helpful for those of you in the room who want to start, expand, grow mental health programs in your own communities. So I am joined up here by John, Idris, and Biggie, who are going to share their wisdom with you today. So first question goes to Biggie. We've heard a lot so far about the importance of mental health work, but it can be a really intimidating thing to start a mental health program from scratch if you don't have one. So can you tell us a little bit about what Farouk has done to get your program off the ground and any advice that you might have for those looking to get started?
My name is Semfuka Jonita Wari. You can easily call me Biggie. Simple. My pronouns are Biggie. Just Biggie. At least I'm a human being. That's what is important. So how did we start talking about mental health? If I talk about where we came from, maybe it will take almost 3 days or 4, but where did we start from? Recognizing that the fact that we need to be well to serve our communities well. So if I am mentally unstable or mad, I am not able to give services to the people that need to get the services. So we started by incorporating mental health in our programmings. Everything that we do is cognizant of the fact that everyone has to understand what we are doing so that they are able to serve the communities well. From the policies, you make sure the person who is giving a service, if you're a clinic manager, you know why you're doing that job. It's not for just earning. You're doing it because maybe probably you experience the same, and you must make sure the person who is receiving the services keeps coming back because it is convenient for them to receive the services. So that's where we started from. And then we got into the journals that we send out each and every day. Oh, please check out if you want to know about the work that we do. I may not be in position to explain kila kitu, everything. You can just scan this and get to know, read about it, get more information about how we do it, and probably you can ask questions even after here because I have very limited time to speak to you. We also have podcasts that speak about different things. Mentally, how do we deal with these situations? How do I deal with the parent who doesn't like me? How do I deal with a stranger who said some demeaning words to me? How can I get help? You will find it on here. And you will have contacts where you can speak to people on how you can speak to us or other people on how they have dealt with certain issues. Everything that happens to us is talked about on our podcast. Even the retreats that we have as part of our mental wellness, from the board to the staff, and then to the peer educators, and then down to the membership. Everything that we go through, how we deal with it, please find it on our different podcasts. Things to do with finance, things to do with activism, things to do with abuse, things to do with all the challenges that we happen to get, we share with them. And very soon, next week, we shall talk about how hard it is to attend international conferences like ILGA. Not only ILGA, there are other conferences, but we share with people who have never experienced this. We share with you. Just this kind of gathering can mess with your mental wellness because you don't know how to deal with it. You don't know how to go here. Which one do you attend? Are you supposed to be everywhere? Such things. Everything is shared here. So we have an opportunity to deal with different challenges, share with you different challenges that we face, but also giving you solutions. So from there, that's how we've incorporated mental wellness in our programmings. Thank you.
Thank you, Beggy. So turning it over to Idris, your organization, HAPA Kenya, has done great work in mobilizing peer educators and volunteers to extend the reach of your programming further into the community. Can you tell us a little bit about how you went about that and some of the strategies that you used to make that so successful?
Well, thank you for this opportunity. Hello. Hello. Is your mental health okay? I'm concerned. Hello. Well, thank you for this opportunity. Like you said, HAPA Kenya works with peer educators and volunteers who are at the backbone of our program, our mental health program. The strategy that we've used, first strategy is the selection of the peer educators. And luckily in my country, we have guidelines of how to pick peer educators. I think the clear guidelines on key population, MSM especially guidelines, has helped us in terms of picking the right peer educators because picking is done by the community themselves. I know some program, we failed in the past where we went around thinking that people we know they are peer educators and some of them were rejected by their own communities. But it's important to let let it be a meaningful engagement. Let the communities themselves have a voice in terms of recruitment of the volunteers and the peer educators, because they're the ones who will facilitate mental health services in terms of awareness creation and linkage to services. The other strategy we've used is advocating for mental health programs within the country. So because I cannot be everywhere, at least in the counties that we implement, we are part of the Key Population Technical Working Group. I think even matters of SOGI, approaching it from the health component, I think for most of us has been the strategy for you to engage conversations and even, advocate for SOGI community-related issues through especially with governments. Governments, anywhere they hear about health, I think they easily are open to engage. And I think the technical working groups have been very key, because we are telling them that as a country, you need to realize that the peer educators need to be equipped with mental health programs. You need to procure drugs and tools and develop guidelines related to mental health, and that is in progress. Mathenge, I think, will talk about some guidelines that we are developing in the country. Then the other thing is partnership. We cannot work in silos. It's important that we have a mental health program, but then we also preaching the mental health word. People are getting to understand that there is importance of mental health. We are making sure that we are going to learn from programs that are doing mental health programs within the country. Luckily for the active program, Hapa Kenya is implementing an effective mental health program. There are a lot of organizations within the country are coming to see how frontliners are being taken care of in terms of their mental health, how activists, how our staff. It's important because even productivity, we've seen our staff and volunteers, become more efficient when it comes to work. They're in an environment that they're safe, especially their mental health. So the networks and partnership have been so key. So, and then also the other strategy is virtual mobilization. I know not everyone wants to associate with SOGI-led clinics, especially because of fear of the unknown. Not everyone is out like me and you and others. Some of them within the community, due to different challenges, societal barriers that are within us, they're not able to freely come to our centers. So we're also educating them, because most of the community members that we know, and we know their pseudo accounts, they'll get to Facebook and ask questions, and they'll make calls, because we have telecounseling. They'll be able to get services regardless of whether they're out or not. For us, our interest is everyone wellness should come first. Thank you.
Thank you, Idris. And last but certainly not least, John, who joins us from Hoimas, based in Nairobi. So John, we've talked a lot this morning about mental health programs that are provided by LGBTIQ organizations, but we know that we need to be working with the mainstream system as well to build their ability to provide mental health services, to provide appropriate and affirming mental health services, and this is something that Hoimas has done a lot of work on. So can you tell us a little bit about what that's looked like?
Thanks. Good afternoon, everyone. My name is John Mathenge. I am from Hoimas, Kenya. Hoimas is based in Nairobi, Nyeri, Kirinyaga. We have 4 community-led clinics, which are based, and especially for Nyeri and in Kirinyaga, are based in the government facilities. We actually had a conversation with the government, and they gave us a space within the government facilities. So those are the community-led organizations. Those are that's Hoimas in Kirinyaga and in Nyeri and in Kajiado, where we actually in the government facility. So mental health is real. And when you talk about mental health, it's real for all of us, and especially we are the LGBTI community. And through that, we have really worked with the government. And one of the things that we worked with the government, because we realize we as a community are doing so much work in our facilities, but we can't do it all, because actually whatever we do, like in Kenya, we collaborate with the government to make sure that we talk about the issues of mental health. And we cannot ignore the mainstream organization, like the government, also like the other big NGO, like most of us are community-based organizations, but we also have NGOs that are doing the work. And out of that, we also have few less psychiatrists. Like in Nairobi, we only have 2. If we have 2, you go to Mombasa, maybe there is 1. You go to other counties, there is 1. So we make sure that we refer our people, our community person. We can only work through the peer navigators. When I talk about the peer navigator, because Idris has talked about the peer educators. So because we, as a country, have a mental health guidelines, which is for the general populations. That was developed in 2 years back. And we were also included. It doesn't talk about the sexuality, but it's a guidance that talks about the mental health of a human being. So we also are queer people, we are also human. So we are also treated as human on that. I know there is a lot of stigma maybe when you go to the mainstream facility. Right now, Kenya is in the process of making a guideline for mental health only for key population, the sex workers, the PWID, the transgenders, and the men who have sex with men. That is a guidance for only for 4 populations, which in the process is going to be launched on the 1st of December this year, which I'm part of the steering committee of that guideline. And out of that, we make sure that we refer our community, because some of these cases are very big. Even after doing it in our community, we have to make sure that we refer to the government facility for maybe for drugs, you know, like some of the drugs, and some people need to be admitted in those facilities. I know sometimes they call us this is a mental case because of our sexuality, but we also understand we as community, there are also cases that we can't handle. So we refer our people, and we have to collaborate with the government. And within those facilities, we have our case navigators. The case navigators is a person who follows a community person who maybe have that case. And in those government facilities, like maybe in Kisumu or maybe in Nyeri and other, those case navigators, whenever we have a very big case, we make sure that we refer them, and they make sure that they accompany that person to the government facility for treatment. And our cases are always taken very seriously because we have a very good rapport. And also to reduce the stigma, we made sure that our community, our case navigators are always there. They take tea together in those mainstream organizations. They stay together. I think even if we are criminalized in Kenya, I know homosexuality is not, it's criminal, but unless you are caught having sex. So if you are walking on the street and you are a gay man, no one have a problem with you. Only if you are caught having sex. So for us, our mainstream, sometimes they work. Not all of them. It's only the mainstream that we have trained the healthcare workers. But sometimes they keep on transferring. And I know it happens to different countries and in different countries. They keep on transferring people. So our work is to keep on repeating the same work to make sure, even if we are criminalized, we should always have the best care in those facilities. And that's now for what we are doing as a Kenyans, and we are hoping to have the best guideline. And in case of you need a draft guideline on mental health, we'll be able to share with you. We can drop your email address. We'll be able to share with you so that you can also implement it into your country. We also have a screening tool which is a form which is used by the peer educator before they refer you to the government, before our clinicians in our CBOs, in our community-based organization, refer you to the government facility. We have a screening mental health tool which actually will determine whether you need to be referred to the mainstream facilities. Thank you so much.
Thank you. Thanks to all 3 of you for what you've shared. It's been really lovely to hear your experiences. I think we maybe have time for 1 to 2 questions for the panel, if anybody has them, before we send you on your way for lunch. Are there any questions in the room that we can answer?
I think we may be underestimating the size of the challenge, and I'm wondering how we can elevate things. And I'm saying this because I know in Kenya, for example, the government spends roughly 11 US cents per capita on mental health services, and the vast majority of that goes to psychiatric institutions where they lock away the crazies. The WHO guidelines are that you need to spend $5 per person. And South Africa is currently the only low and middle income country that does that. And even in South Africa, mental health services are not sufficient. So what is the big idea? What's the big change that we can make to jump from where we are now to where we need to be? Because we can keep making incremental changes. And I think providing mental health support to activists and leaders in the movement is essential, but that's not enough. I feel scared listening to this conversation in some respects, because I feel like the challenge is so big. How do we fix it?
I think this is an eye-opener that we need to realize that there's minimum funding and support when it comes to mental health programs. In as much as it's a big problem, as you said it, but really there are no much support when it comes to mental health. And I'm looking at how we're going to diversify funding when it comes, even if it's, someone said in a group I was, I think today, someone was saying, and I think it's the first speaker who said, we really care about security of the community. We look at physical. Do we remember that people have issues on their minds? And these are especially frontliners. So I think diversifying funding and realizing that really there's need for commitments and inclusion of funding, even in the big funding mechanism like the PEPFAR and the Global Fund, to prioritize mental health. Because really, even with these good activities that we're implementing, if people are not okay upstairs, I think they are not going to be effective to them. So there is an importance of us to think of more funding for mental health programs. And thanks for the SLF and Active, who've really prioritized. Like they give us an exclusive funding to support mental health. And I think most funders need to start thinking that way.
Thank you. And thank you for that question. In the room, if we have activists that have been in this same place for years, if you notice the change in how we organize, what does that say? In a room like this, we will have people fighting each other. We'll have a team this way versus a team that way versus the team here, which is changed. Why do you think it's changed? People are dealing with mental health issues. And we need to appreciate, before we get there, we need to appreciate that we are a step. I can see activists that have been there for some time. Ishmael, you know, my brother, you know, and others that I may not have recognized. But we used to have battles. Coming for ILGA used to be war. It used to be war. But now, why isn't it the same way? There's a better way to deal with issues. So before we get up there, we need to first make people appreciate the fact that we need to be well to deal with issues. That is self-explanatory. It shows the calmness. Even with protests for inclusion or complaints there, they're a bit calm. When I was still a young activist, we used to have wars. We come prepared. The next day we are like, we must face this guy. Do you know what we're going to do? You will make noise from that end, I'll make noise from this end, and so that our issue is hard. But we were sick. We didn't know that we were suffering from something. And so, having gone through that, and with the help of people, with the Canadian government, through Active, and to us, through Stephen Lewis Foundation, we are able to do such things. We are able to have a get-together as staff. Do you know that there are some people working together, but they have never shared a meal? They only, hi, good morning. Good morning is not enough. I would say I'm fine. Fine is not an answer. That's why everyone, when someone asks me, how are you? I'm like, do you really want to know how I am? I will not say fine, because fine is what is expected of everyone. But am I really fine? Am I able to tell you that, oh, this morning, am I able to tell you that? Even when you're not that close to me, can you allow me to say, oh, the morning was... Because the The cleaner just bumped into my room. You know, they just opened the door. Am I able to tell you that? Before, it wasn't that okay. But now, because we know that we need to be mentally well to serve the people, we have the mood swings. We people who menstruate have mood swings during that time. And we give it to you the way it is. Sometimes people used to say that lesbians are just, those guys are moody. When you go to their meetings, they are moody. But do you know how many people are experiencing menstruation during that time for this meeting? Of course, they're going to give it to you as they feel. But the fact that we are considerate of mental wellness of others, you're mindful. You're like, okay, I'm menstruating, but okay, I get mood swings. I will try to smile. Okay, I'll make sure, I will pretend to smile. Even when you're pretending to make sure that the other body is okay, it's okay to do that. So we are cognizant of the fact that me being well means the other person has to be well, so that we have an environment that is conducive to everyone. Even when you're going through something, you may not even feel the fact that, oh, I've lost an uncle, but I'm at ILGA. But then they are giving me love. Every morning they'll say, are you okay? And so that will put a smile. It's incognizant that mental wellness is important. People think mental wellness is just this extreme thing. No. The fact that I say, you're looking nice. Yeah, you see, it's going to put a smile on their face. We didn't know that. We used to come to conferences like this to battle each other. I must make sure that they don't go through. I must make sure that my issues. But then we recognize that the fact that even when I think you've not served us right, I'll gladly say, you know, okay, you can come back after this time. The other time, you can come back and serve. You know, demurringly telling someone that I like the way you give service, but it's not working. But it's okay, you can think about it and come back.
Unfortunately, folks, I think we're over time, and ILGA is very strict about timing. I know there's questions that we haven't been able to answer, and I'm sorry for that, but I'm sure our panelists would be happy to answer after the fact if folks have questions. On behalf of ECADE, on behalf of the Stephen Lewis Foundation, big thank you to all of our panelists, everyone for participating in the breakout sessions. I hope the session gave you some food for thought. I hope it gave you something to take away and share back with your communities at home. Please don't forget to sign up to receive the post-session report if you haven't already. We will be sending that out so you have a nice souvenir of your time with us this morning. I hope everyone enjoys the rest of your day, enjoy your lunch, enjoy your travels home, and I'm sure we'll have the chance to connect again soon. Thank you so much.
We are so glad you joined us for this important conversation. We hope you will feel inspired to share what you have heard today and to join the solidarity movement to defend health and human rights for all. As a partner in pride with the Stephen Lewis Foundation, you can make a difference today. Find out more on our website, subscribe to our newsletter, or reach out to us to find out ways you can get involved. Through local action and global solidarity, we will build a more just and equal future free from AIDS. Thank you and have a great day.